Honourable Senators, I rise today to speak to Bill C-62, the government's second bill to extend the sunset clause on the prohibition of assisted suicide for mental illness. Before I get to my comments, colleagues, I would like to take a moment to recognize the work by all of the members of the Joint Special Committee on Medical Assistance in Dying regarding the current bill before us, as well as for all their work since the beginning of the committee. The committee did its work the best it could in the difficult circumstances given by the government. And I want to thank all members of the House of Commons, senators, expert witnesses, and hundreds of Canadians who took time to appear as witnesses, submitted their opinions to the committee. All were crucial to the important parliamentary work completed by the Joint Committee. To begin, I also want to point out to my colleagues that I will not be using the term medical assistance in dying, referring to it by its acronym during my speech. I will only use the term and acronym where it is a direct quote. The reason for this, colleagues, in my opinion, referring to assisted suicide as MAID gives it the veneer of a medical procedure. We are no longer referring just to people hastening death, but administering death to people who are not dying. And by using an abundance of acronyms to describe assisted suicide takes away the humanity from the question. Now, having said that, colleagues, I respect the choice of all of my colleagues to do so, but as a personal belief, I cannot. Colleagues, almost a year to the day, here we are again at the 11th hour, having to save Canadians from the ill-conceived plan by this Liberal government to introduce assisted suicide for mental illness. Just like it did last year with Bill C-39, the government has tied our hands to pass this legislation expeditiously. How did we get here? From respecting a Supreme Court decision to a government stuck on ideology. Since the introduction of Bill C-14 in 2016, I have actively participated in the debate of every governmental piece of legislation on assisted suicide, whether it was during committee meetings for Bill C-14 and Bill C-7, or debates in this chamber. I have added my voice with compassion and empathy for all involved. I have respected the convictions of all senators then, like I do for all senators today. Life and death is a deeply personal question for all Canadians on all sides of the debate. Canadians have been debating this question for many decades and will continue to do so for many decades to come. While suicide was decriminalized in 1972, the debate on assisted suicide continued. From 1972 to the legalization of assisted suicide in 2016, Canada has seen the Law Reform Commission of Canada recommending against legalizing or decriminalizing voluntary active euthanasia. In 1983, court cases like the Supreme Court decision in Rodriguez versus British Columbia in 1993, and to parliamentarians submitting private members' bills on euthanasia, the first one in 1991. Our very own chamber has had various committees studying the question as well over that time. What has brought us here more specifically today is the Carter decision by the Supreme Court in 2015. The decision struck down the ban on assisted death to those near death and who had irremediable medical conditions. It gave Parliament 12 months to come up with new legislation. Therefore, after an extension granted to June 2016, the federal government introduced in April of 2016 Bill C-14, and this bill received royal assent on June 17, 2016. Like in 2016 and 8 years later today, I remain opposed to any form of assisted suicide. But understand our country was put in a situation by a decision from the Supreme Court of Canada. I accepted that fact at the time and still do today. During the C-14 debates, my objective then remains the same today. While I oppose the assisted suicide in all its form, I do want to be a voice for improved access to living with dignity, for stronger safeguards in the system, and to defend the sanctity of life. Following the adoption of C-14, the nature of the debates shifted. We went from the Supreme Court imposing a deadline to Parliament to the Liberal government prioritizing MAID expansionist ideology over evidence-based medicine and consideration of patient safety as a whole. While the Supreme Court of Canada offered no option other than respecting its decision, in the case of the Truchon ruling by the Superior Court of Quebec in 2019, the Liberal government still had other legal options. It could have done the sensible thing to defend its own law by appealing the decision of the lower court in Quebec. Instead, this government made the ideological decision to broaden Canada's assisted suicide regime beyond the Truchon ruling. As you may know, safeguards were removed with Bill C-7 and introduced Track 2 for assisted suicide to those not dying. Track 1 remains when death is reasonably foreseeable, where people can access assisted suicide the same day as a request, and patients can make themselves sick enough to bypass safeguards. In its original form, Bill C-7 excluded mental illness. Once the bill arrived in the Senate, our colleague Senator Couture introduced the amendment of a sunset clause of 18 months to the prohibition of assisted suicide for mental illness. Again, then Justice Minister and Attorney General David Lametti and the Liberal government had a choice. They could have easily rejected the amendment proposed by Senator Couture, like it often does to Senate amendments, to defend its own legislation. Instead, on the advice of David Lametti, the Trudeau government made the choice to push forward the expansion of assisted suicide. The initial amendment by Senator Couture proposed an 18-month sunset clause, but the government estimated it needed 24 months. The government's position went from a complete ban on assisted suicide for mental illness to 24 months, based on no parliamentary review and no expert panel. It was and remains today an arbitrary deadline. During the 2 years, the Joint Parliamentary Committee studied the question and heard compelling testimony, while a government-appointed expert panel studied the question. The Joint Committee heard expert testimony confirming that there remains insufficient data to objectively guide assessing irremediability. We can't do it, and no medical evidence exists to distinguish between suicidality and an assisted suicide request. If such a distinction exists, for example, the Centre for Addiction and Mental Health concluded, there is simply not enough evidence available in the mental health field at this time for clinicians to ascertain whether a particular individual has an irremediable mental illness. Senator Batter spoke briefly about that when she said that she believed mental illness was never irremediable, and I would concur. Professor Brian Misera, Director at Centre for Research and Intervention on Suicide, Ethical Issue, and End-of-Life Practices at the University of Quebec in Montreal, stated in his opening remarks, and I quote, "If it were possible to distinguish the very few people with a mental illness who are destined to suffer intermittently from those whose suffering is treatable, it would be inhumane to deny MAID. But any attempt at identifying who should have access to MAID will make large numbers of mistakes. And people who would have experienced improvements in their symptoms and no longer wish to die will die by MAID. Even the government's own expert panel on MAID and mental illness stated in its report, there is limited knowledge about the long-term prognosis for many conditions, and it is difficult, if not impossible, to predict irremediability. I could go on from what that committee heard during the 24-month period, but colleagues, you see the picture. There was no data to support the possibility to safely justify assisted suicide for mental disorders. And its own expert panel confirmed the near impossibility to predict irremediability. The assisted suicide regime the government put into place is based on a patient's condition being irremediable. Since irremediability is impossible to predict for mental disorders, surely the government should have changed its course. But David Lametti and the Trudeau government thought otherwise. Another year was added to the sunset clause until March 17, 2024, with the adoption of Bill C-39 last year. In October 2023, the Joint Committee was tasked to assess Canada's readiness to safely administer assisted suicide for mental disorders. And as you all know, colleagues, based on the expert testimony heard at the committee, in a race against the clock, the Joint Committee reported that Canada was not ready. On irremediability, Dr. Mona Gupta, chair of the government's expert panel, agreed that nothing has changed since May of 2022 report concluding that irremediability remains difficult, if not impossible, to predict. Dr. Tarek Raji, chair of the Medical Advisory Committee for the Centre for Addiction and Mental Health, agreed by stating, "There is no scientific evidence on it. We still cannot at this time determine at the individual level whether the person has an irremediable illness or not." On suicidality, Dr. Sarin, chair of the Department of Psychiatry at the University of Manitoba and the chair of the academics chairs, cautioned that assisted suicide for mental disorders could facilitate unnecessary deaths and undermine suicide prevention. It was therefore clear from the Joint Committee that irremediability and suicidality remains unresolved. With a lack of professional consensus, the Joint Committee concluded that the medical system in Canada is not prepared for medical assistance in dying where mental disorders is the sole underlying medical condition. Unfortunately for certain psychiatrists and doctors in this very chamber, who I have all the respect for, believe they have the answer. And again, as I said, while I respect them, I cannot understand why they are adamant in not respecting the lack of consensus amongst their professional peers. We are not talking about reaching unanimity. We are talking about reaching a professional consensus. At this point, it is an undisputable fact. Irremediability, which is at the core of the assisted suicide regime in Canada, cannot be accurately determined for mental disorders. Colleagues, this will be the second time the Liberal government is asking us at the 11th hour to save Canada from sliding further down the slippery slope of medical assistance in dying. At first, many people opposed to assisted suicide warned of a slippery slope, only to find out Canada was actually standing on the brink of a cliff. Our concerns have been dismissed since the very beginning, and more forcefully since Bill C-7. While the proponents gave us assurances of assisted suicide being limited to a small number of cases, the truth of the matter is sadly the complete opposite. Since 2019, Canada has seen an average yearly increase of 31.1% in total assisted suicide deaths, resulting in 4.1% of all deaths registered in 2022. And since 2021, the adoption of Bill C-7, Canada registered 222 assisted suicides whose natural death is not reasonably foreseeable, and 463 in 2022. Colleagues, at the current rate, the report for 2023 could indicate over 16,000 assisted suicide deaths, which would represent the cumulative total of 2020 and 2021 in 1 year. Canada has quickly become the world leader in assisted suicide, surpassing countries who have had a similar law for decades longer. According to an analysis by the Investigative Journalism Bureau and the Toronto Star, in the past 2 years alone, more people have died under Canada's assisted death regime than in any other nation in the world. Dr. Sun Yu Gain, Chief of Psychiatry at Sunnybrook Hospital, said, "We are on a trajectory that no other country on the planet has gone, while not knowing what the full impact is going to be." At this point in time, colleagues, no one knows what the full impact is going to be. Projections by the Trudeau government have consistently underestimated the number of assisted suicide deaths. According to projections by Health Canada in 2018, our country would reach a steady rate of 2.05% of total deaths attributed to assisted suicide. It gets worse, colleagues. In the update on regulations for monitoring of assisted suicides and dying, committed in May 2022 in the Canadian Gazette, Health Canada has projected assisted suicide-related deaths to reach a steady growth of 4% by 2033. Colleagues, we have surpassed Health Canada's own projection by a full decade by reaching 4.1% in 2022. How can we trust this Trudeau government and the Minister of Health that assisted suicide for mental disorders will only affect a small number of people? The floodgates are wide open, and instead of doubling the efforts in closing them, the government is stuck in its ideology to further open them. Under this government, Canada has moved from having to put in place an assisted suicide regime due to a Supreme Court decision to an expansion of the regime for ideological reasons. The majority of the provinces and territories requested an indefinite pause. No professional consensus can be found to distinguish accurately suicidality from an assisted suicide request. And the majority of surveys find Canadians not in favor of assisted suicide for mental disorders. The last survey from Leger poll was released on February 13th, and it still showed a majority of Canadians against or unsure about offering assisted suicide for solely mental disorders. Let me be clear, colleagues. The debates we had on C-14 were the most compassionate and respectful debates on a divisive issue that I have seen during my time in the Senate. Although we had different opinions, we all came from a place of compassion, empathy, and understanding. And I, too, do have compassion for people suffering, just as much from a physical illness than from a mental illness. I really do, colleagues. Too often, people opposed to assisted suicide for mental disorders have been characterized as uncompassionate, and that's happened here in the past week again. My opposition to assisted suicide for mental disorders is not out of believing someone suffering from mental illness. Mental health is less than someone suffering from a physical ailment. It is based on a lack of evidence and a lack of safety of such an expansion, as well as a strong belief that the government should be putting more efforts into offering better quality for mental services. The federal government should be helping psychiatrists and all mental health practitioners to improve services to help Canadians who are suffering instead of facilitating the path to suicide. Colleagues, I, like you, have friends and relatives who would not be here today if they had been given a choice on a day of depression under some of the laws that we are proposing. And they are living productive lives. Canadian Physicians for Life agrees and stated the following in its submission to the Joint Committee on Resource Shortages. With acute human, financial, and material resource shortages in mental health care and services, it seems counterproductive to commit those resources to expanding MAID to those whose sole condition is mental illness. We have seen a significant number of resources expended on the healthcare system to make MAID available for those at the end of life. More resources have been added to expand MAID to those who are dying. It will create cognitive dissonance on the healthcare system to expend more resources to run parallel systems of suicide prevention and suicide assistance. In 2022, Statistics Canada reported that over 5 million Canadians aged 15 and older met the diagnostic criteria for mood anxiety or substance use disorder in the previous 12 months. In the same survey, it showed that more than 1 in 3 Canadians who have a mood anxiety or substance use disorder said their health and mental health care were partially or fully unmet. Finally, the survey concluded, and I quote, "Increasing the supply of healthcare providers who focus on mental health and have specific training in this area is one of the many possible solutions to improve access to mental health care in Canada. However, disparities in health insurance coverage for medications and counseling services also need to be addressed." Furthermore, a poll released in September of 2023 by Angus Reid Institute found that a vast majority of Canadians concerned with the mental health resources available in the country, as well as the state of Canadians' mental health overall. On the following statement, MAID eligibility should not be expanded without Canada improving access to mental health care first. 82% feel mental health care should be improved first before MAID eligibility is expanded. Finally, half of Canadians worry that treating mental health won't be a priority if MAID eligibility is expanded. Colleagues, during our Committee of the Whole, I was so disappointed when the Minister of Health kept talking about the need to train more nurses and more psychiatrists in evaluating if a patient with a mental disorder could qualify for assisted suicide. Canadians are saying the exact opposite. More training and resources are needed to help patients suffering from mental health illness to recover and live well, not to determine if they qualify for death. They'd rather see the federal government put in more efforts in improving mental health services instead of expanding assisted suicide. The Canadian public is clear more needs to be done to improve mental health services in Canada. Until Canadians have equal access to affordable and quality services for mental health and physical health, until we have evidence on how or if we can medically and accurately detect who will not improve from mental illness, we cannot legislate access to dying from mental illness. While I disagree with assisted suicide in general, I cannot change that. But just like I can't change assisted suicide in Canada, the Trudeau government cannot continue pushing on Canadians the expansion of an assisted suicide regime for mental disorders with the lack of general consensus from professionals and Canadians. For example, during its hearings, the Joint Committee received hundreds of submissions. And here are about just a few different associations that I would like to share. The Arch Disability Law Centre submitted a brief, and I'll quote two passages. Bill C-7 became law. Persons with disabilities have resorted to MAID because they do not have other viable options for living with dignity in the community. Some of these stories have been reported in the media. Their concerns go further. Arch is deeply concerned that expanding MAID to cases where mental disorder is the sole condition will lead to even more cases of people with disabilities, including mental health and psychosocial disabilities, contemplating, applying for, and receiving MAID due to socioeconomic suffering. The Canadian Association for Suicide Prevention submitted the following recommendation. Increased funding should be available for health care to ensure that treatments are available to patients so that lack of access to treatment does not cause the condition to be deemed irremediable. As well as the Evangelical Fellowship of Canada agreed that assisted suicide must not become an option, especially not the most accessible option when mental health care may not be accessible or affordable, when treatment and support are not available. The EFC states, and I quote, "The EFC is opposed to MAID, believing it fundamentally devalues human life and normalizes suicide. We are very concerned that MAID for mental illness will disproportionately impact marginalized Canadians. If Parliament is going to go ahead with MAID for mental illness, it is essential that the strongest possible safeguards are in place to protect Canadians in moments of vulnerability before this expansion takes place." Colleagues, I wholeheartedly agree with that position. Bill C-7 eliminated important safeguards, and even with the current existing ones, we've all heard various stories of assisted suicide being offered way too soon in the process or to unqualified patients. For example, late August, an article in the Globe and Mail told the story of a Vancouver woman who went to a hospital seeking help for suicidal thoughts. The person in question lives with chronic depression and suicidality. Feeling particularly vulnerable, she went to the Vancouver General Hospital looking for psychiatric help. Instead, a clinician told her there would be long waits to see a psychiatrist and that the healthcare system is broken. She was then asked, "Have you considered MAID?" It is totally unacceptable for a patient to be asked about assisted suicide while seeking help for suicidal thoughts. Thankfully, the story indicates the patient was awaiting to see a psychiatrist last fall. And I sincerely hope and pray she was able to receive the help she needed. Nevertheless, colleagues, stories like these, or like the ones we've heard about an employee at Veteran Affairs suggesting assisted suicide to multiple veterans, or the story of an Ontario woman with severe sensitivities to chemicals choosing assisted suicide after her search for adequate housing failed. Somebody approved that, colleagues. There are too many to ignore. My intent is not to generalize the whole assisted suicide regime, but it is part of a number of stories we have heard at an alarming rate. These are only the ones we read in the paper. Not everyone would be comfortable to publicly share a deep personal story. I am disappointed that the tone amongst us has changed since Bill C-7 was introduced. I have said so many times, and I've said it already twice today, the debates on C-14 were some of the most respectful debates I have participated in the chamber. Senator Harder referred to some of these debates yesterday. Although Senator Joyal and I disagreed on many things, including assisted suicide, I fondly remember how my friend and now retired colleague walked across the chamber floor, thanking me for my speech because he knew it came from the heart. He appreciated my participation in debate, just like I appreciated and highly respected his contributions. Sadly, that same amount of professionalism and respect has sometimes left this debate. More and more Canadians, experts and politicians who are opposed to assisted suicide for mental illness are unjustly painted as lacking compassion, their work discredited and insulted for holding different beliefs. Instead of having a debate and a conversation on assisted suicide for mental illness, we are treated to a constant confrontation of you're either with us or you're against us. You're either compassionate or you're not. The proponents of assisted suicide for mental illness have taken a confrontational approach by vilifying our beliefs and discrediting our position, even though it is based on facts. And colleagues, we are not in a confrontation. The issue of life and death is much too important to be treated as a confrontation, but it should be as a moment where we discuss and debate with the highest of respect for each other's positions and beliefs. During second reading debate on Monday, in my opinion, that line was crossed. Clearly frustrated with how things were not moving according to her preferred timetable, Senator Simons lashed out at every person in Canada whose views are different than hers. She said, "We are in a culture war," that the pushback against assisted suicide is akin to the war on reproductive choice and the war on gender-affirming medical care. She labeled those who view these issues differently than her as religious, fundamentalist, and misogynist. Colleagues, these kind of accusations and polarized rhetoric is not what we need in this debate. The issue itself is divisive enough without inflaming the discourse further with these extreme characterizations. Perhaps the good senator has forgotten how much Canada has changed on social issues over the last 50 years. Perhaps she does not understand the angst of those who wrestle deeply with the moral aspects of these questions because of their deeply held religious or other moral convictions. Perhaps she is unaware that these are not mere whimsical preferences on the part of those who are troubled by the freefall we find ourselves in on matters of conscience. These positions are deeply rooted in our values, our beliefs, and our entire worldview. These things are not trivial to us. They are things that keep us up at night. Not because we have any interest in telling others how to live their lives, because we weep for what will become of future generations if we continue to deny the sanctity of life and erode the protections surrounding that. I will acknowledge that those of us in Canada who continue to hold to the sanctity of life from conception to natural death are the minority in Canada. This is clear. Yet understand, we are not asking for the power to impose these beliefs or implications of these beliefs on every Canadian. We are simply asking for the right to be heard. We are simply insisting that our rights be respected as well. The right to hold our beliefs, the right to speak openly about them, the right to engage in debate and be heard, the right to try to influence public policy. This is not extreme. This is how we got to where we are today. The very existence of these rights allowed Canada to shift from the societal values that I hold dear. Yet I would be the last person to suggest that this means these rights should be curtailed. Yet this is exactly what the tone and mischaracterizations brought by Senator Simons on Monday might suggest, that those who disagree with her should be shamed and silenced. It seeks to suppress their voice and tell them that they can have their beliefs but just don't speak about them in public. Colleagues, we need to do better. We must do better. The debate we have in front of us today is too important and deserves better than what we saw and heard on Monday evening. It is hurtful to be unjustifiably characterized in that manner. So I will simply remind colleagues that on the important question of life and death, Canadians deserve better. As much for Canadians who want access to assisted suicide for mental illness as Canadians who caution to expanding assisted suicide for mental illness. The debate needs to return to a place of respectful compassion and understanding. It is time to reset the tone of the debate in Parliament and in Canadian society on assisted suicide. Like Dr. Sen Plett said in his brief to the Joint Committee, this should not be a partisan issue. The cautions about providing aid for mental illness are not about politics or ideology. But unfortunately, in this polarized debate, these cautions have been dismissed as just being the other side. Nothing could be further from the truth. Such claims wrongly dismiss legitimate concerns in this complex debate. Dr. Gain is absolutely right. The debate on assisted suicide for mental disorders should not be limited to hearing only from those in favor, but also from people who have concerns. We need to hear the stories from people who continue to live and fight for better care. Stories from people like my own mother. Ruby Plett, who is 96 years old, with crippling arthritis, a difficult quality of life, but wants to live on because she wants to continue to pray for her kids and her grandkids while enjoying their visits. Now, thanks to having access to quality physical care, my mother can continue to live, see her children, grandchildren grow. She has that opportunity, and more Canadians deserve the same opportunity as she does, whether they are suffering from physical or mental health. Sadly, the state of mental health care in Canada dictates that a patient suffering from mental illness does not have the same care and opportunities as those suffering from physical illness. Now, make no mistake, colleagues, many times, my mother has had the desire to go home, to be with her husband, her son that died before her. And if ever there was a candidate for assisted suicide, my mother would be at the top of the list. But she would be horrified if somebody would suggest that to her. Horrified. She would be horrified to think that anybody but God had the right to take her life. So she prays that she could go home, and then we come in and visit, and then she's just happy to be around again. Now, although the state of care in Canada remains a challenge, we have various groups and centres across the country who go above and beyond. The Haven Group in Manitoba is an example of excellence in delivering exceptional care to its residents. It was founded nearly 80 years ago by members of various churches in the area, and to this day continues to be operated by 8 local churches. A brand new home, Rest Haven, 130-some residents, was built just a few years ago. My mother was the happiest person. She was the most senior person moving in, and she got to pick her room. She was the first one before construction was even finished. So she definitely thought she was in the waiting room to heaven. She feels a little different now. She thinks she could maybe move out of that room and move on. Nevertheless, these churches continue to operate. Haven Group and Rest Haven is committed to providing long-term care to residents in a Christian environment and an emphasis on holistic approach to care, regardless of age, race, religion, including people with physical illnesses, mental illnesses, dementia, Alzheimer's. I do not have enough praise for the exceptional staff at the Haven Group and their tireless dedication to an exemplary level of physical, emotional, social, spiritual, and intellectual care. Through loving and caring, the residents are reminded daily that their lives are worth living and how valuable they are. Now, I have mentioned only a handful of groups and organizations that deserve all the praise, and I'm sure they are not the only ones. Across the country, we have similar stories of individuals who offer premium care for service for Canadians to live their lives at the fullest. Their voices and stories also need to be heard in this debate. All Canadians belong in this discussion. Plurality and diversity required. Unfortunately, that is not the case for all groups, however, that they have these freedoms, who can conscientiously object to assisted suicide. While Haven Group can provide care to its patients along their values and not provide assisted suicide in their buildings, they are by law mandated that if somebody asks for assisted suicide, they have to direct them to a facility that will offer them that against their beliefs. A Delta hospice in British Columbia did not receive even that treatment. On February 25th of 2020, the BC government decided to end the service agreement with Delta Hospice Society due to their refusal to offer assisted suicide to its patients. Despite assisted suicide being offered in a nearby building, the Delta Hospice Society lost its privately funded building, and Canadians who do not want to be offered assisted suicide have lost a safe space. For Canadians who do not want anything to do with assisted suicide, there is no escaping. According to Ramona Coelho, in an article appearing in the Macdonald-Laurier Institute, Health Canada's 2023 Model Practice Standard for Medical Assistance in Dying approach to conscientious objection is troubling. As it states in Section 5, healthcare providers who object to providing assisted suicide, even in specific cases, are considered conscientious objectors. And what is a physician to do? Simply refer the patient so they can seek access to assisted suicide? Colleagues, with effective referrals, like Dr. Kello demonstrates in her article, instead of assisted suicide process being stopped, it funnels patients towards death in the current system. Therefore, a Canadian who wants assisted suicide can effectively shop doctors. It is chilling to know that our healthcare system has a component to lead and ease Canadians towards death. How far have we fallen from C-14? The eyes of the world on Canada wondering what is happening while various experts are raising the alarm. The regime needs to be fixed, not expanded. Colleagues, on the question of life and death, every Canadian's perspective matters, and every senator's opinion in this chamber matters. It is because our heart beats that we care so deeply about life and death, whether you are a doctor, a lawyer, a business owner, or a tradesperson like myself. We all have a different view because the question of life and death is the most personal of questions. It is based on our life experiences, on our walk of life. I see the compassion and the difficulty for Senator Ravalia on this question, and it is clear he comes from a place of compassion because of what he has seen and what he has lived. And I have empathy and understanding for him and all the Canadians he is representing on this issue. I only hope, and I know from him I have, the same empathy and understanding. And from others, I hope to be shown to people like myself who want to do more to improve access for better options to live a life in dignity instead of further opening access to assisted suicide. As I've always said, when it comes to assisted dying, it is a very personal, emotional issue on which reasonable people can agree. Life and death is also the most common question that unites us all. Whatever your career or your background, you are born in this world with your heart beating, and you leave this world when your heart stops beating. While I am opposed to euthanasia of all forms and assisted suicide, that is not to suggest that in any way that I do not have profound sympathy for those who are suffering intolerable pain, whether that stems from physical or mental illness. I am not saying someone who suffers should be forced to live through anguish. I do not want mental health patients to have more prolonged suffering, nor do I believe they suffer less or differently than physical illness. My goal is for everyone who suffers to have better access to living instead of an easier access to dying. In a country as wealthy as Canada, I cannot help but feel we are giving up on life just a little by continuously pursuing this avenue instead of improving access to living. The long-term effects are unknown, and in a question of life and death, unknowns that could have dire consequences, and I do not wish that for our country. My objective here today is not to change your position on assisted suicide. We will disagree on assisted suicide, either agree or disagree on assisted suicide based on our beliefs and our own life experiences, and that's okay. I respect each and everyone's position and beliefs on this matter. What I do hope is to bring to your attention the other side of the debate that keeps being dismissed. And colleagues, I am just a few minutes from being done. Based on expert testimony, your Joint Committee clearly states that experts cannot agree on the remediability or on suicidality and recommended that Canada is not ready. The numbers are alarmingly high in the Canadian context and in comparison in the world. Projections by Health Canada have underestimated the results, and the death rates by assisted suicide in Canada is the fastest in the world. These numbers clearly confirm the slippery slope of assisted suicide in Canada, and it pains me that that is the case because we are talking about Canadian lives that are in the balance. Most provinces requested an indefinite pause. Most importantly, Canadians do not want assisted suicide for mental illness. They'd rather see an improvement in mental health services. In a time when the improvement of mental health awareness is improving, when we are encouraging Canadians to seek help, that is okay to speak up when times are dark, that no one needs to suffer alone, where stigma and barriers are being removed. Let's build on that momentum. It will take time and effort to improve access to quality mental health services as the same level of physical health services. It won't be easy, but I remain confident that all the compassion found in this debate and with strong political and medical leadership, we can overcome the mental health care challenges in this country and improve the mental health of all Canadians. I remain steadfast in the belief we can and must do better. Colleagues, while various experts took part in the Joint Committee study, hundreds of Canadians also took time to share their stories with the Joint Committee, and out of respect for the time they have taken, I will share just a few. Christine Alberts from Lloydminster, Alberta, who submitted to the Joint Committee. Thank you for taking the time to read my submission. For this past year, I am grateful that you have saved my family members, friends, and countless Canadians struggling with depression and other mental conditions. However, we are again at a moment where if action is not taken, death will be presented as a solution rather than support and life. Death is something that is final, and offering it as a treatment option normalizes ending someone's life. I am very concerned that we are not prepared or ready for these changes to take place, as MAID is set to be expanded to those where mental health is the sole underlying medical condition. The experts said we weren't ready a year ago for these changes. Nothing has changed, and lives are again at stake. Or from the group of 30 Canadians who jointly submitted a brief. They are a group of people with disabilities and or family members and friends of people with disabilities and mental disorders who are directly menaced by the imminent passage of assisted suicide for mental illness. They are not opposed to assisted suicide for those who are suffering extreme pains as their lives approach a natural death, but they are opposed to it for people who are not dying. Here are just a few passages from their brief. We know that a 90-day waiting period for MAID is not a serious safeguard. Some of our loved ones have pretended to be treatment compliant for much longer periods. People with mental disorders are quite capable of forming and holding self-destructive plans for years. Canada should not implement these dangerous laws unless and until social support systems are fully and generously operational and the social detriments of health are adequately and demonstrably addressed in every province and territory. We are specifically talking here about a safe, affordable housing and adequate financial support. Not everyone with a disability or a mental disorder can work for wages. Our loved ones who cannot work in the system should not be penalized for their disabilities. Colleagues, while I support Bill C-62, it is not to be seen as an endorsement of any assisted suicide under any form. I would prefer that the idea be put aside indefinitely. But in the meantime, colleagues, I will accept this 3-year delay in the hopes that the federal government will eventually listen to Canadians and the experts and do the right thing. Thank you for your time, colleagues.